Hello. Hello and welcome
Hi.
to our virtual book launch. My name is Maria and I'm your host. Um, Good afternoon, good morning, good evening, depending on where you are in the world right now. Um, as we begin, I would like to just go over some housekeeping. At this point, I'll ask for everyone to just mute their mics and allow for the speaker at any given time to be the only one who's unmuted so I do not have too many interruptions. With that said, I'll call upon Maya to give us the opening and welcome remarks.
Yeah. Good morning, good afternoon, everyone. Thank you for attending the book launch. I'm Maya Hinflaar. I'm the Director of Research and Programs at the Southern African Institute for Policy and Research, which is an organization based in Lusaka, Zambia. And we're very honored to facilitate the book launch today of the book called The State and Imperative for Social Policy Reform in Africa. So the objectives of this event, this webinar, is just to introduce the book, have a discussion around it, and officially launch the book, which I'm glad to say is open access, so available for everyone in this room and beyond. To start with, I would like to introduce the editors of this book. You can see the names on the screen, but just a short description. So we've got Rosina Foli. She's a senior lecturer at the Political Science Department of the University of Ghana. She has a doctorate in public policy from the Johnson Shoama Graduate School of Public Policy, University of Saskatchewan in Canada. She has teaching and research experience in public policy analysis, political institutions, policy making, developing country studies, and global governance. Her work has appeared in many journals, including the Global Social Policy, Policy in Society, and Poverty in Public Policy. She is currently doing research on impact of external actors on social policy making in Africa, as well as social policies, inequality, and the COVID-19 pandemic in sub-Saharan Africa. The second author I'm introducing here is Priva Hang'andu, who's originally from Zambia and a good colleague of ours. Priva currently works as a senior policy advisor for the Canadian Institute of Health Research, which is an agency of the Government of Canada. He obtained his PhD in public policy from Johnson Shoama Graduate School of Public Policy, the same place where Rosina went. He's published extensively in peer-reviewed journals and consulted policy analysis, social policy, governance, electoral democracy, disability policy, and gender research. He has a particular interest in the role of institutions in international policy development. He's also done many consultancies for ECOWAS, UNICEF, SAIPAR, Global Business Coalition, and he's a regular speaker on the role of institutions such as judiciary, law enforcement, and electoral bodies in the advancement of electoral democracy in Africa at the Canadian Africa Study Group in Ottawa, Canada. And beyond that, he also serves on the editorial board of several internationally reputed academic journals. And then last but not least, we've got Danielle Béland. I hope I pronounced it correctly. Danielle is the director of the McGill Institute for the Study of Canada and the James McGill Professor in the Department of Political Science at McGill University. He's held visiting academic positions at Harvard University, University of Bremen, University of Nagoya, Southern Denmark, Woodrow Wilson International Center for Scholars. He's also the executive director of the Journal of Comparative Policy Analysis and president of the Research Committee 19 of the International Sociological Association. He's published more than 20 books and 20 peer-reviewed journal articles. In the audience, I'm not sure everybody's already there. We also have some authors of individual book chapters, because this is an edited volume. There's a lot of book chapters in this book. And some of the people who are attending today is Jeremy Seeking of University of Cape Town, Greg Gondwe of Harvard University and University of California, and Florence Ndagire, who works for the United Nations. What I find interesting about this book, I haven't read the whole book yet, but what I've so far caught from the book is the significance of social policy reform debates in Africa, and I think this is a really good contribution to it, as it's reconsidering social policy reforms that took place in Africa after the COVID-19 crisis, which of course was a big crisis, which prompted some rethinking around social policy reform. Given the importance of an effective social welfare system in crisis situations like the one presented by the COVID-19 pandemic, this interdisciplinary volume explores the imperative of social policy reform in Africa and the potential nature of such a reform. What is really nice about this volume, it's very forward-looking. So it's not only looking at the past, and it's really well historically grounded in the history of social policies, going all the way back to the colonial times. But it's also looking forward, like what can we do, what have we learned to make sure that we improve our social policies that help protect individuals, families, and communities against exposures to insecurity, poverty, and other vulnerabilities throughout their life cycle. So this book is interesting from an academic point of view, and contributes to the literature, but it's also very relevant to policymakers and practitioners. So I'm looking forward to the discussion of this book, and I hand back to Maria to take us further through the program. Thank you.
Thank you so much, Maya, for setting the scene for the discussion that's going to follow. I'll call upon Dr. Rosina Foli to give us an introduction of what the book is doing. I won't even speak about what it seeks to do, but what the book is actually doing.
Hello, everyone, and thank you for having us talk about our book. The state and the imperatives for social policy reform in Africa was conceptualized at a time of the COVID-19 pandemic. Prior to the COVID-19 pandemic, most developing countries had fragile health systems, which relied heavily on external funding, imported medical supplies, and foreign expertise. For instance, over 40% of health spending in low-income countries came from external sources. This varies widely across countries. And about 80 to 90% of medicines, medical supplies were imported. So with these statistics, and also looking at the ratio of health personnel to the population, where in Africa we had about 1.3 health workers to 1,000 people, compared with about 12 health workers to 1,000 in Europe. Within this context of all these things, COVID struck in 2019, in the latter part of 2019, and it quickly escalated to a global health emergency, such that by January 2020, it was declared by the World Health Organization as a health emergency, a global health emergency, and was declared a pandemic early March of the same year. Now, the main containment measure of this pandemic was physical distancing, lockdowns, travel restrictions. And in Africa, about 80% of our total employment is within the informal sector, where you need to go out there, you need to interact with people in a face-to-face manner to be able to make a living. And majority of the people within this informal sector are women. So our lives are built around contacting each other, and all of a sudden, there are lockdowns. You can't go anywhere. You can't go to the market to buy what you need to buy or to sell what you need to sell to make a living. And so this caused economic problems in several countries. It impacted tourism. It impacted informal sector workers heavily. These are people who had low wages without any social protection at all. And so these restrictions affected them hugely. Then we also have containment efforts, which were challenged by several. So some people looked at it and said, how can we go about this? And you're asking us to put on nose masks. Some didn't even believe in it initially. I remember, especially in the early days of the pandemic, some in my country, for instance, didn't even believe there was anything like COVID-19. And so the restrictions and the advice that was given, they didn't want to follow it. But the economic challenges were real, and this way, the misinformation and the lack of trust when it comes to citizen and the public service interaction complicated the control of the pandemic. Besides these challenges, which is more internal, we also have the external challenge where wealthy nations were hoarding medical supplies because, as I indicated earlier, most of our medical supplies, especially those of us in sub-Saharan Africa, we get it from external sources. So where there is hoarding and restrictions, and these countries were keeping vaccines, medical supplies, PPEs for themselves, it created and prolonged the health crisis that we have. So the structural problems that we have, the ratio of population to health workers, the rural and urban inequities that we have, all complicated the challenges of controlling this pandemic. Within this, when you compare it to external or countries outside of Africa, where they have stronger social protection systems, some of these automatically kicked in to support the population. So myself, Priva, and Daniel, we had a discussion about this. And we said, if only our systems could be reformed such that we'll have some of those things kicking in automatically. So where there are restrictions, people can have access to basic necessities that will help. So these ideas motivated us to launch this book project, and we got help from our colleagues, scholars in the region in sub-Saharan Africa and African scholars in other parts of the world. And from here, Daniel will take over and talk about the book. Thank you so much.
Thank you very much, Rosina. Thank you for the organizers, because I think it's a great opportunity for us to discuss this book. This book is in open access, as you can see on your screen. And it's a book that is the product of long discussions. First that Priva, Rosina, and me had during and immediately after the pandemic. It's a book that takes an historical and comparative perspective, but as was said earlier, it's also forward-looking. And I don't know who can move the slides forward, talking about forward-looking, because I want to discuss the contents of the book, and it's probably better if people can see them. Yeah, can you move a bit more forward again and again? That's perfect. Thank you. And so the reason why I'm involved in this project, it's a long story, but as was said earlier, both Rosina and Priva completed their PhD at the Johnson Shirayama School of Public Policy, and I occurred to be their PhD supervisor. And it was really a pleasure to work with them, and now I'm really happy to see what they have done, what they have become as scholars and policy practitioners. And I'm also really excited about the team that we assembled for this volume. All the contributors, most of whom are based in sub-Saharan Africa or hail from the continent. And it's a book, I think, that is written in a way that can be read by not just scholars, but also by practitioners. And so we hope that this and the fact that it's available in open access will help, spread the message that's in the book, not just studying what has happened, but also looking forward at, what can be done to improve social policy on the continent. The book really is about exploring the social policy architecture in SSA countries, and then to see how we can better protect citizens when facing future crisis situation, but also more generally, even beyond crisis, how we can improve social policy on the continent. And then there is a really great variety of topics. If you look at the table of contents, we have chapters on automatic stabilizers, the challenges facing healthcare systems. We have a chapter on education systems. We have a chapter on human rights, and we also have a chapter dealing with, as related to public health. Can you move to the next slide, please? And the volume also pays close attention to the fate of vulnerable populations. So we have a chapter on persons with disabilities and social policy for them, and also a chapter on migrants and refugees. The book also features discussion about formal and informal social protection arrangements as they relate to gender. And we have also a discussion that's quite, I think, very original about social media engagement of young people during the pandemic. And there is also a chapter by Jeremy Seeking about the discussion of the concept of need and how it's defined in different contexts. And we also have a chapter that Rosina and I wrote about the role of transnational actors in social policy reform across the continent, and how these transnational actors, including international organizations, they interact with domestic actors, not just government actors, but also NGOs. So just this short, overview of the book, I think suggests that it's quite diverse in terms of its content. We have the diversity of our authors as well, with different backgrounds, and they come from originally from different countries. And I think we cover a lot of ground. At the same time, the volume is quite concise. And of course, it begins and ends with an introduction, a conclusion that will map the story that we are telling in the book, but also in the conclusion provides specific policy recommendations. And I think it was very important for us to not just take a purely academic stance, but also really try to inform policy debates. Can we move to the next slide? Okay, so here's just the table of contents so that you can see also I cannot name all the authors. Some chapters have quite a few co-authors. Others are single-authored, or they have just a couple of co-authors. But you can see, looking at these names, that we have really some really excellent contributors, some of whom are with us today. You can move to the next slide. And we hope, of course, that this book is the beginning of the conversation that will continue in different ways moving forward with our contributors and beyond. And now I will let Priva continue and talk more concretely about the policy side of things and basically the forward-looking aspect of the book and what we think is important to keep in mind in terms of policy reform on the continent. So Priva, it's all yours.
Sure. Thank you so much, Daniel and Rosina, for setting the stage. And thank you to Maya for those very kind words of introduction. Okay, so by illustrating the gaps in the social policy infrastructure in countries in sub-Saharan Africa, what we try to demonstrate here in this volume is that countries need multifaceted approaches to build resilient social policy systems. And so to begin to address these gaps, we propose that social policy systems in Africa must be self-reliant. They must be inclusive of the demographic diversities within their populations. And also they must be open to learning from best practices around the world. And they must be structured to respond to global crises. We therefore conclude our book by offering 6 concrete policy recommendations for considerations by policymakers. In my view, these recommendations are also important for social policy scholars, all of us around this table, for students of social policy, for think tanks like SAIPAR, for policy advocates and other stakeholders who are strategically positioned to influence social policy reforms. So the first recommendation we make is that while it is important for these countries to sustain their pre-existing indigenous or family-driven safety nets, they should also pay attention to the global evolution of social policy programs and draw lessons to continuously restructure their own programs. So we propose that legitimate, credible, and resilient social policy institutions and systems that are rooted in sub-Saharan African countries and contexts could actually emerge through a combination of what we call lesson drawing, which is assessing policies implemented in other countries, as well as translation, which is the adaptation of these policies into specific country jurisdictions. The second recommendation we make is that sub-Saharan African countries should reconstruct their policy systems within the broader context of institutional reforms, good governance, and economic management. And the reason for this argument is that it is clear from the variety of chapters that you read in the book that strong social policy systems are a product of coherent and self-reinforcing institutional frameworks. In sub-Saharan Africa, despite many countries being endowed with rich natural resources, you will notice that formal economies have remained marginal. Their institutions have remained very weak, and their social policy systems are heavily reliant on foreign aid, as Rosina mentioned at the very start of this conversation. So this combination of factors, we observe that it significantly exacerbated Africa's vulnerability and fragility during the COVID-19 pandemic, and it must be addressed to avert similar catastrophes in the future. We stress, therefore, that strong institutions are a precursor to economic growth, and economic growth is a bedrock for every solid social policy system. The third recommendation is that sub-Saharan African countries should broaden economic growth through industrialization. As seen in other jurisdictions around the world, the relationship between economic growth and resilient social policy provision is actually inextricable. So we argue that industrialization boosts economic activity, it creates jobs, provides a basis for revenue collection that bolsters disbursements of citizens in moments of vulnerability. Next slide, please. If you could also move to actually the next slide. And the next slide. Thank you. All right. So in the fourth recommendation, we propose that sub-Saharan African countries should build robust capacities and systems for taxation. And this is because a country's fiscal strength has corresponding implications for its capacity to support strong social safety nets for its citizens, and especially in moments of crisis and acute vulnerability. So a country's taxing power is central not only to the state's capacity to raise revenue, but also to its capacity to provide goods and services to support the market economy. And here we stress in this volume that the state's capacity to collect revenue is crucial for social policy reforms in sub-Saharan Africa. Our fifth recommendation is close to the second one on good governance, but it's more specific to public accountability. We recommend that states complement their capacity for revenue collection with building administrative capacity, and especially systemic accountability and the erection of credible anti-corruption mechanisms, which for a long time proved a key issue in debates about social programming, even in the global north, for example, in the United States. So sub-Saharan African countries should at the same time grow capacities to collect revenue, but they must also build strong institutions that detect, punish, and deter extractive practices, often institutionalized in political leadership. The final recommendation we have is that sub-Saharan African countries must pursue the diffusion of social investment as a new policy paradigm that reconciles social policy with economic rationality through an emphasis on measures that increase labor market participation, while at the same time fostering human capital through investment in things such as training, early childhood education, and skills training. So you will notice as you read the book that among our many conclusions, that the pandemic and its lessons reinforced the reality that leveraging social investment and social spending is a much more effective response than austerity to such a systemic crisis. So those are very, very strong conclusions that we make at the very end of the book. So once again, I'd like to thank you for your participation, and we look forward to your comments and questions. I'll hand back the mic to our wonderful moderator. I think it is Mukosha Ondanji, whoever is moderating. Thank you so much for the opportunity.
Thank you so much for giving us an understanding of what the book is doing. Having gotten a glimpse of the overall recommendations, I'll call upon the chapter authors, a few of the chapter authors, to speak on their specific key findings from each of their chapters, as well as the policy implications of their findings. So to start, I'll call on Jeremy Seeking to just speak on this chapter.
I don't think he's there right now, so we probably go with the next person.
Oh, okay. The next person is Greg Gondwe. Is Greg here?
I know it's 2 a.m. in California right now, and Greg might be fast asleep.
Okay.
I know we have a couple of them around. We have Pacho Ogalo is around. I've seen Pacho, so maybe they could go first.
Okay, that's perfect.
So Pacho worked with, we do have as well as Kadiatu is around. They could speak if Pacho is not able to unmute.
Hello.
Oh, there you go. There you go, Pacho. Good.
Hello.
Hello. You can go.
Yes, thank you. Thank you. Thank you. This is Dr. Pacho from Kisi University. And we wrote the chapter with Mahona Joseph. And probably I will ask Mahona to say something because I'm in the middle of something which is a bit urgent. Mr. Mahona Joseph, can you say something about our chapter if you're available? Thank you. Mahona.
Hi everyone, my voice is bad. I am not feeling well. So, but I just happy to say that most of what Priva said in our chapter. So it's just yeah. Thank you. So we do not have to say so much about this chapter because we decided to give some advice to the scholars, to the world on how to improve education in the future, or when any dangerous disease or any occurrence takes place, like a COVID, what happened, we saw the effect of it, and now we need our chapter suggest some implication and some suggestion of what will be done so that to avoid so that students both in higher education will be able to continue with education. Thank you.
Okay, thank you very much. Priva, I think I'll ask for you to speak on the chapter that you co-authored with Florence, just to share some of your findings and the recommendations from there.
Absolutely. Thank you so much. So I can speak to that. I'm going to ask my co-author, Dr. Florence Ndagire, who is joining us from the Netherlands, to introduce herself and to make a few remarks after me. But also there's a chapter that I worked with Dr. Brian Kaaba. If he's around, please would welcome his remarks as well. So I'm going to make a few remarks on the chapter on persons with disabilities and social policy in Africa. So, so recalling the principles that are promulgated in the Universal Declaration of Human Rights and the Convention on the Rights of Persons with Disabilities, you know, we look at the principles of universality, indivisibility, and interdependence of human rights, and aware of the unique needs that the global crisis presents on persons with disabilities. So this chapter seeks to investigate the effects of COVID-19 on the well-being of persons with disabilities and how inclusive the policies and response measures were towards this population, this group of citizens in the global, in sub-Saharan Africa. So the question really is not so much what we should do for marginalized groups, for persons with disabilities, for example, in moments of crisis, but who is at the table when policy instruments, or who is not at the table rather, when policy instruments are being designed. So in Canada, Indigenous people, for example, have the slogan, which I've also seen promulgated in the United Nations Convention on the Rights of Persons with Disabilities, which is nothing about us without us. So no one knows better than marginalized people themselves and equity-seeking groups how to address their own problems. So in this case, with persons with disabilities leading the way, we need to identify what barriers they experience in healthcare, in education, in employment, in the built environment, in technology, and then begin to design with inclusion from the start. So what this chapter does is to interrogate some of the response measures for the COVID-19 pandemic in the context of a case study of Uganda, and how information was disseminated, how response measures were designed, and what we see is that there's a very huge disproportional impact on persons with disabilities. And we look at reproductive rights, for example, within that chapter, and how persons with disabilities and the measures that were put in place really put them in a corner that exacerbated some of their own experiences and could have been averted if they had been included from the very point of view of design of those response measures, including information dissemination. And I'm going to ask Florence Ndagire, my co-author, who is the first Ugandan blind person to actually get a PhD, and also a very strong advocate of human rights, to just chime in and give a bit more context and flesh to our chapter. Florence, please, if you can take it away.
Thank you very much, Privilege, for co-authoring the chapter with me, and thank you, the organizers, for inviting us to the launch. I am Dr. Florence Ndagire, a woman with lived experience of disability because I was born blind, the first visually impaired lawyer in Uganda, and the first to graduate with a PhD. So, one of my PhD chapters was actually social policy and COVID-19, and thanks to the publishers, yeah. There were so many policies that we formulated during that time, but persons with disabilities were forgotten. My respondents revealed a number of things that were missing, but this is just because they were not represented in the policy-making platforms. For example, the findings reveal that we were required to have social distance, but to persons with disabilities, they say social distance did not mean physical distancing because we needed support at that time. And of course, everyone was scared to establish contacts with people with disabilities just because they were scared of contracting COVID-19, which was really problematic. Policies on curfews and also were discriminatory because there were people with physical disabilities who couldn't run during curfew time, and many of them were arrested, others were shot by security personnel who did not understand the needs of people with disabilities. So basically, in the policies, there was a missing link between the lived experiences of persons with disabilities, their needs, and their voices in the policies were really misrepresented or underrepresented. When it came to information dissemination, on radios and televisions, people with disabilities were forgotten. Sign language was lacking in the presidential information campaigns and other public health campaigns. The blind people were forgotten in the description of hand washing. The audio did not describe specifically how do you wash the hands to clean them in order not to contract COVID-19. Then there were some rural urban dynamics where some people did not even own a radio to listen to this information, and that was really general, but also excluded people with disabilities in particular. For the reproductive health case, the maternity wards were turned into COVID-19 isolation centers, which left issues of family planning, reproductive health services unattended to. Most of the information concentrated on COVID-19, forgetting issues of HIV/AIDS and contraceptives. And also because COVID-19 kept many people at home, there was a lot of gender-based violence. There was a lot of issues of rape and harassment, especially to people with disabilities by their own caregivers, which was problematic. And if this research did not address this, then nobody would have known. A number of things happened. Lockdown affected people with disabilities heavily because when it came to ending contracts, their contracts were ended fast. Those who had small capital, limited capital, or small businesses ate all their money because COVID-19 lasted for a very long time. and yet even recovery programs forgot them. So this chapter calls upon all law enforcement officers, governments, to consider the needs of persons with disabilities, to have them represented on the policy-making body, to ensure that they are consulted and supported during crises like this, and to make sure that disability is given a priority in any other pandemic that might come. Thank you very much.
Thank you so much, Florence. Would you like to add more to what she said, Priva? Hello? Okay, I think we can go ahead then. Okay, Priva, are you back?
I think the link in SAIPAR is frozen. Maybe we can move to an audience question.
Good. If you could ask Dr. Kadidiatu if they're still online to just make a few remarks. And any of the other chapter contributors, if they are able to just chime in just quickly within a minute or two to just make a few remarks. If not, then we can move to questions and answers. We are happy to open.
Bonjour.
Bonjour.
Je vais parler en français.
Oui, c'est bien, vous pouvez parler en français, oui, merci.
J'espère que on va se comprendre. Et ça, ce fut vraiment un plaisir pour moi de porter le lead de ce chapitre qui a apporté une perspective francophone dans le livre. Parce que moi, j'ai présenté l'expérience du Burkina Faso, du Niger, du Sénégal et puis du Mali, notamment concernant la réponse qui a été apportée pour les personnes démunies pendant la crise du Covid dans ces pays. Et ce qui ressort, c'est que les pays sont partis de l'existant, de ce qui existait déjà.
Vous êtes à Kadio?
Vous m'entendez maintenant?
Oui, on vous entend.
Voilà. Donc, je disais que moi, ce fut un institutionnelle qui a été apportée aux personnes indigentes démunies pendant la COVID. En se disant aussi que ces pays, sauf le Sénégal, les trois pays sont traversés par une crise sécuritaire depuis de longues années qui renforce vraiment la vulnérabilité dans ce contexte. Donc, ce qu'on peut retenir, c'est que dans ces pays, les politiques sociales ont été une continuité de ce qui existait. Donc, les gouvernements ont essayé de pouvoir partir de ce qui existe et les difficultés comment je pourrais dire ça, les difficultés des questions de ciblage qui existaient ont également réagi dans la mise en œuvre de ces politiques-là qui ont été données aux personnes pendant la COVID-19. Donc, ce que je peux résumer, c'est qu'on a vraiment besoin de renforcer nos systèmes pour qu'on puisse, pour des prochaines crises, pouvoir vraiment avoir des systèmes de santé assez robustes pour pouvoir répondre à des crises telles que la COVID. Donc, voilà ce que je peux dire globalement par rapport à la contribution que j'ai eu à apporter dans ce travail. Merci beaucoup.
Merci, Tadio.
Yeah, is there any other author who would like a co-author, a contributor who would like to say something at this stage?
Okay, I don't see any. So, moderator, I think you can take it away. We are happy to chime in with an interaction of questions and answers at this point. Thank you.
Okay, I just need the confirmation that you can hear me.
Yes, we can.
Okay, lovely. Thank you very much for your presentations, and thank you for sharing some of the insights from your chapters. I'll open the floor to the audience. If there are any questions, you can raise your hand or send a message into the chat, and I'll read it out for you. Any questions? At this point, you could unmute yourself and speak, if that would be more convenient. We've got a question.
Hello, can you hear me?
Yes. Please go ahead.
Hello?
We can hear you. Please go.
William, we can hear you. Could you speak? Looks like we've lost William.
I can ask a quick question here. Not having read the whole book, just introduction and conclusion. To what extent do you think, how fundamental was COVID in the whole story in changing of social policy reforms? Or does it coincide with other forces at the time which kind of forced governments to rethink their policies, including the kind of decline of ODA since 2012 and increasing pressure on external financing as well, and then the kind of more call for local agency?
Rosina, I would like to go first.
Yes. Let me address this first, then you can add to it. So COVID was really a critical moment. Yes, ODI was reduced and there were other things happening. But then the immediate push that necessitated or that drew the attention of the whole world and of all practitioners within the continent to the need for reforms was the COVID-19 pandemic. I remember that at that time, there was this general call by all citizens that we need to look at our policies, we need to change, we need to introduce new policies to help citizens in critical times like that. And so even though there were other global challenges going on, the actual push for us to look at reforms in social policy specifically came from the pandemic. Priva.
Thanks, Rosina. Daniel, would you like to go next?
Yeah, I think it's important to understand with the pandemic. I mean, it's global impact, and I think that it has raised a lot of because I've done quite a bit of work on the pandemic, its impact in the global north, right? And I think it's interesting to compare, although we don't do that in the book. That might be something useful to do maybe in future research. Is that the pandemic was a shock in many countries, but at least in the global north, in most countries, we haven't seen path shifting processes in terms of how the social protection systems have evolved. So they were relatively minor changes that we can talk about here. And so I think that was a lost opportunity in some areas like long-term care, for example, to do meaningful work. And the problem is that once the crisis is over, then we have a situation where there is less momentum for change. And I think the issue in sub-Saharan Africa, like elsewhere in the world, is how can we, draw lessons from the pandemic and try to fix some of the problems we identified during the pandemic before the next pandemic or the next major crisis hits the various countries. So I think this is important to understand that there's a global perspective here on COVID-19 because it was a truly global pandemic, and that we have to take a comparative lens because you have major differences within the same continent in how countries were affected by COVID-19 and how they responded to it. And so I think that it's trying to understand the relationship between these global forces, the diffusion of some policy solutions, the interaction between transnational actors and domestic local actors, while paying very close attention to the trajectories of specific countries over time.
Thanks, Daniel. I think just one last addition I would make is that, yes, the pandemic was a big trigger. It was a once in a lifetime experience. But I also just want to highlight here that as a result of that, one of the important lessons here from lesson drawing is that many countries are beginning to have what they call pandemic preparedness programs, which are heavily funded in their annual budgets. They focus not just in healthcare, but they look beyond the impact of beyond the healthcare, other social programs. And I think this is a very, very important and very key consideration for African countries to not go to sleep because the pandemic is over, but to continue to build support systems, to build capacity for preparedness for the next event, even if that event is going to be in the next 100 years. The manner in which we are caught unawares and the manner in which the exogenous factors just fell because of the nationalistic attitudes that the impetus that grew from the global north, I think is a huge, huge warning for us in the global south that we need to never go to sleep and to continuously re-engineer capacities and grow capacities such that the next pandemic should never catch us unawares. And that means a whole spectrum of social policy issues beyond just the healthcare issues. Thank you. I see that we have a couple more hands. Happy to take a few more questions.
Okay. Konadu, you can ask your question and then followed by Mumbi Musonda. And then after that, we'll have the editors respond to them.
Hello, please, can you hear me? Hello?
Yes, we can hear you.
Yes.
Okay, all right. So one of the policy recommendations was building institutions to punish and deter extractive practices. Yeah, so my question is, how does the book address the challenge of building these institutions when the people who build them and the leaders who are meant to regulate are the ones responsible for creating them?
Thank you very much, Konadu. Mumbi, your question?
Good morning or afternoon, or everyone. The question I have, I've noticed that you've put up some recommendations like reforming the taxation framework, and you probably reviewed a lot of data like on social spending. So my question, because I've seen that there are a lot of countries represented, can you please speak to me in terms of how challenging it was gathering the information, and what kind of lessons can you share with us in terms of dealing with government and NGOs in terms of getting information for you to come up with a recommendation? You must have gone through a lot of information. Can you speak to the journey in terms of how accessible that information was, and what you ended up doing to be comfortable with the data that you had? Thank you.
Okay, thank you very much. I saw Mahona had raised his hand, but it's down now.
My question has been asked by the previous speaker, so I just have to wait for the response from editors. Thank you.
Okay, all right. So Daniel,
do you want to start, Priva?
Absolutely. Thanks, Daniel. Yeah, happy to start. So I don't remember the names. I remember the second one, Mambim Sonda, obviously, but the first one was the question about public accountability and how do you ensure that you have systems that are credible, that prevent, deter corruption, when the same systems are created by the people that are trying to, so I think that maybe it's not really a chicken and egg question, but I think that, the whole concept of lesson drawing is very important to addressing some of these issues. So it is possible. I mean, it's abundantly evident, it's happening everywhere in the world, that we can develop good democratic institutions in the global south, in Africa, in the global south. We can hold our leaders to account. We can, and it's not a secret. I mean, this is done everywhere in the world. So how did the Netherlands, how did South Africa, even, very close to home, how did any other country you want to talk about? The United States used to be a big example. Now it has collapsed. We all admit it's a collapsed example. We don't want to refer to that anymore. But the point here is that you can build institutions that are credible if you hold your leaders to account. If you develop credible democratic institutions that reduce the cost of transaction economically, that inspire confidence in investment. I don't think that leaders go into office not knowing that they'll be held to account. I think we can, we can respond to that demand for accountability by building a strong civil society, for example, by building strong opposition political parties that pose credible threats to the incumbents, by mobilizing capital and capacity for policy development, by making use of some of the best minds and brains we have in our own countries to develop systems, and by learning from what's been happening and been done elsewhere. We can definitely build very credible anti-corruption systems and mechanisms that would pose significant threat to anybody, to our extractive political leadership that we see very often in sub-Saharan Africa. So I think that's what I would say about that. I don't know if there's any magical word to do that, but I think it's very possible to do that. We obviously offer some very great insights into in our recommendations, if you flesh them out a bit more. But I don't think there's a magical or a bulletproof way of doing it other than what has been done elsewhere, and the evidence is abundantly available. Before I go to the challenge of gathering information and the journey for arriving at a conclusion in terms of taxation, I'm going to let in Daniel comment, and maybe Rosina as well, if you have anything to add on that.
Yeah, you can go on that, Rosina, and I can comment later on taxation.
Okay. All right. Yes, I just wanted to add to what Priva stated about building strong institutions. And he mentioned the role of citizens, which is critical. And just to link to the role of citizens is the idea that if we are able to generate resources internally, then if I'm contributing, I'm interested in knowing what my revenues or what I contribute is used for. So the accountability mechanism is built in there. It becomes something that citizens desire to require of their leaders. But if you don't contribute to the state management, you don't pay your taxes, and these revenues are coming from external sources, in most cases, the motivation to seek for accountability is weakened in that respect. So the call for strengthening taxation systems could help our accountability institutions to be strengthening of the accountability institutions. If our taxation system is strong and we are contributing as citizens, we'll be interested in knowing what these things are used for, and we'll be calling on our leaders to account more often. Thank you.
Yeah, just on taxation and where the information is available. I mean, yeah, there is the OECD, there is the Revenue Statistics in Africa series. That's pretty useful. There is the International Center for Tax and Development, and then they have a government revenue data set, right? And also there is some information you can get from, World Bank and IMF. But when you look at specific countries and you want to dig deeper, especially when we talk about, tax collection at the subnational level, in a more like fine-grained level, then it depends. It varies a lot from country to country, but I think it's not always optimal. That's for sure. So there's quite a few countries have transparency issues there. But fortunately, there are these broader databases that help us kind of look at the big picture in terms of fiscal revenues. And of course, we don't have a chapter specifically about that in the volume, but I think that the issues that we raise about fiscal extraction are already well known and documented. Priva, do you want to add something about this?
I think I'm good to pass. So yeah, we have there's a lot of available evidence in terms of taxation in Africa. We have some of the colleagues that are doing incredible work in that sector. We don't have a chapter specific on taxation in the book, and maybe in future we'll consider that. There's one of my good friends, Sevia Mwamba in New York, working on taxation in Africa. Incredible work that is done, including on Africa and in mining sectors, and how they contribute to the national revenues. I see among the participants, we have Dr. Muna Ndulo, who is an economist at the University of Zambia, and also director at SAIPAR, who has done incredible work in economics, and not just in Africa, but also around the world, taxation included. So we do have a lot of information that we can draw from on taxation. We haven't had an opportunity to dig deep as an individual isolated chapter in this book, but it's certainly a theme that comes up that if you want to grow economies, you definitely have to look at the revenue collection side. Social policy is not a system that you can sustain by, outside influence and outside, as we have seen during the COVID-19, that it can easily collapse if the dependence is on outside forces. You need some resilience, and all the examples that you can draw from that have resilience and that performed well during the pandemic, they all have effective taxation systems. And there's a lot of academic evidence that poor countries and developing countries also tend to tax 20 to 40% less than the developed countries. So that in itself produces vulnerability. It produces fragility that in the event of a shock like we had during the COVID-19 can very easily lead to a catastrophic outcome. Thank you.
I just want to add, Priva, thank you for that, that I have a book forthcoming at Cambridge University Press, a short book. It's Cambridge Element with Michal Corey and Olivier Jacques, and it's a book about welfare state financing. The focus really is on the global north, but I think that many people here will find it's a really systematic, critical review of the literature on welfare state financing and the relationship between taxation and social policy. And I think many people all over the world, including the global south and particularly in sub-Saharan Africa, will find this work interesting. But there's already scholarship, of course, specifically about sub-Saharan Africa. But I think that the challenges that are faced on the ground on your continent are challenges that also exist in other parts of the world. And I think it's important to have a broad comparative lens when we focus on the relationship between taxation and social policy.
Okay, thank you very much to our listeners and the people who've joined and asked questions. Thank you for engaging. I will call upon Daniel to officially launch the book and inform the people who've joined on how to access it.
Yes, thank you very much. So the book is, so if you want, basically, if you Google the title of the book, and you can just go on the Palgrave website, and then what I can do is I can put the I don't know if you're already there, but I can put the URL for the book in the comments section, and people just have to cut and paste the URL, and they can access the book directly on the website. And once you're on the website, the Palgrave website, look. I think I can share my screen now. I don't know if you will see it now. Okay. I'm on the Palgrave. You go on the Palgrave website, and then you just have to, below the title of the book, it's download book PDF. And you click on this, and then you have the book. You can download the book, and that's it. You can save it. You can also, if you want to order a hard copy for yourself or your library, you can also order one, but of course you have to pay for that. But the book is in open access, and you just have to click, and depending on how fast your internet access is, it takes a few seconds or maybe a minute or two, and you have access to the entire book. And so I think it was important for us to have this book in open access. The book is published in a series called Global Dynamics of Social Policy. And it's actually financed by the German government through a grant that is based at the University of Bremen in Germany. And we're very grateful to the fact that they provided the funding so that we can have this book available all over the world in open access. And so you just have to click on the URL and the book is yours. So I just wanted and you see the cover of the book here, of course. And if you go online, you can, of course, also see the table of contents and know more about the contributors and so forth. But yeah, the full book is in open access, and it's available right now.
Thank you very much, Daniel. I'm excited to read the book. As we wrap up the discussion, I will call upon Priva to give us closing remarks, followed by Daniel, and then Rosina, if that's fine.
Sure. Thank you so much. I do have a hard copy here. I received my 3 hard copies. So please, feel free to download it and read it on your, on your computer, on your phone, as you eat your lunch, as you drive, or anything else. Like Daniel said, this volume is part of the global dynamics of social policy. So I would like to thank our publisher, Palgrave Macmillan, and the series editors, coordinated by Karina Schmidt, who's at the University of Bamberg in Germany. Would like to thank all our chapter contributors, some of whom are present here today. We tried to demonstrate in this exercise that a community of African scholars and scholars working on Africa can get together and address big systemic policy problems. And our community of chapter contributors managed to do just that. We would like to send a big word of thank you to the eminent scholars who wrote promotional blurbs for our book: Professor Muna Ndulo at Cornell University, Professor Rebecca Surrender at the University of Oxford, Professor Jimmy Adeshina, University of South Africa, and Professor William Esterly of New York University. Would like to thank our unknown academic peer reviewers for their constructive feedback. I would like to express our profound gratitude to the Southern African Institute for Policy and Research, SAIPAR, and to Maya Hinfla Mukosha Funga, specifically for giving us this opportunity to launch the book and to interact with you all. We look forward to future collaborations with you, Maya, and your team. And finally, but not the least, a very huge thank you to all who took, all of you who took your precious time to listen to us and to engage with us, to ask questions. And for you that will be reading the book in anticipation, thank you. So thank you all for your support. I'll pass the mic over to Daniel and Rosina to make their final remarks.
I've really nothing to add because Priva, I think, thanks so many people. And I want to thank Priva and Rosina for their collaboration. And of course, all the contributors. And we hope that this collaboration will continue, not just with the contributors, the volume, but also with some of you here who are attending this event. So if you're ever interested in organizing some event or even thinking about a shared research project, we are open for business, as they say. And so I wish you a nice evening if you're in Zambia or in Sub-Saharan Africa, elsewhere in Sub-Saharan Africa, and have a nice day if you're in a different part of the world. And now I will pass the torch to Rosina.
Yes, thank you so much, Daniel. And Priva has covered all the people we'd like to thank, but I just want to stress again our appreciation, Daniel, to you for the collaborative spirit with which we carried through this whole project, and to Priva. It was great working with both of you, and to all our contributors. We say a very, very big thank you. We send you emails, and you are very responsive to all our prompts and everything. So we are so grateful to you. And thanks so much to the Southern African Institute for Research, Policy Research, also for hosting this launch. Thanks so much to everyone for joining. And we hope that we'll contribute and collaborate a lot more later. So bye-bye.